enjoy our topic today. We do have a different topic every month. There is schedules of our future dates for the rest of the year. We like to get feedback from you. If you guys have any topics that you want us to try to get on our agenda, or people that you think would be good people to bring in and share information, let me know as well. I know Lynn was sharing a few with me earlier. So yeah, we just want to give good information and resources out to our senior community. So if you like how today goes, we do a different topic every month. Next month, okay, we're going to do a workshop. We're going to try it. So it's going to be a technology one. So we're going to have be able to help you if you need my chart set up, if you need the medical alert things set up on your, and mostly iPhone things, and then if you need your Apple Watch set up as well. So tips and tricks for that, and then also setting up some of those safety measures, or just things that somebody you might need help with. All right. So a couple housekeeping things. I'm StephanieParson. I'm a realtor. I've been a realtor for almost 25 years, and we started doing these senior seminars a little more than two, I guess almost 3 years now. So we do them almost every month, different topic, to educate our senior community and talk about important things so that you can be prepared and you are empowered as you age, because there's a lot to know and a lot to navigate through. So if you guys wouldn't mind holding your questions to the end, we try to get through all the information we have. And today we have 2 of our St. Charles County Ambulance District, SCAD.
You got it?
Yeah. All right.
Spot on.
Okay. So we have Sherry and Kyle with us here today. So they're going to talk about some things that you can do to take advantage of, and how to do that, right? Different tools you guys have. And just kind of go over different medical emergency situations and how to prevent those.
How to prevent you.
Prevent those. And then we do have 2 people that is going to share some recent real life experiences along that line as well. So I think that'll be interesting also. So Kyle and Sherry, would you guys mind, if you want to have a seat, have a seat. We do have microphones here.
I'm not a microphone talker. Am I loud enough for you guys? Okay. If I start trailing, throw something at me and I'll start talking. I'll bring the volume back up. That sound okay? I'm too much of a hand talker to be a microphone talker. It doesn't work well. Yeah, and Sherry can attest. Thank you so much for having us here today. We very much appreciate it. As Stephanie said, my name's Kyle. I have worked for St. Charles County Ambulance District for 18 years now. And Sherry has been with us. What year are you on?
I'm on year 26.
Year 26. She started at SCAD when she was 7. So she has been taking great care of our community for a very long time. Again, like I said, over 40 years of experience between the 2 of us here. So there is very unlikely to be a question that you can toss at us that we're not going to at least have a semblance of an answer to for you guys today. We sincerely hope that none of you have had to do any business with the ambulance district. We get it. Nobody wants to have to call us out to their home for any reason. We are an organization that has been around here in St. Charles County for a little over 50 years. We began serving our community on December 30th of 1975, so just over 50 years. And during that time, as you all I'm sure are very well aware, our community has gone through tremendous growth. If you can believe this, we began serving this community with only 3 ambulances covering all 592 square miles of St. Charles County, which is crazy to think about. That first full year of service that we were in operation in 1976, we responded to about 3,500 calls for service. And at that time, our population here in St. Charles County was about 130,000 residents. Today, our population is sitting right at about 427,000 residents. And whenever I started with SCAD, I kind of thought that emergency call volume was tied to population, that it was kind of a proportional relationship between those two things. And if you kind of extrapolate those numbers out, you would generally think that our call volume would be somewhere between 10, 12, maybe 13,000 calls a year. Like, makes sense, right? You can connect those dots. Anybody want to take a guess at what our call volume was last year? Request for service. How many calls did we respond to? Anybody want to toss a number out there into the universe? What do you think? 90,000. A little on the high side. Normally people lowball us, and they'll say somewhere around 15, 16, 18, 20,000 is the standard guess. Our actual call volume last year, 56,309 calls for service. We respond to about 150 calls a day throughout St. Charles County. We do cover all 592 square miles, so no matter if you live in St. Charles, St. Peters, O'Fallon, Colville, Weldon Spring, Lake St. Louis, Winsville, Portage de Sioux, Augusta, Defiance, New Melly, or any other unincorporated area out here, we are going to be great there and take great care of you if you ever do need us. To cover that very vast service area, we have got now, as of 2 weeks ago, I would have told you 18 stations covering that 592 square miles, but as of May 19th, it is 19 stations covering those 592 square miles, with the opening of our brand new station in Winghaven. If you go south down Winghaven Boulevard and hang a left onto Phoenix Parkway, we just opened a new facility right there, kind of if you know where the air conditioner manufacturer Nordyne is there on the corner. You go in a little bit further, there's a Goddard School preschool there on Phoenix Parkway. We're right there in between the two. And if you've got nothing going on May 30th on Saturday, we would love to see you as we host our open house that day. We will, I promise you, you've got it on good authority right here. We'll let you push the button to turn on the lights, and we even have popsicles too. So all kinds of good stuff you can come do.
Kyle, how many total, is this working? How many total, I guess, ambulance areas do you have? And not like stations, I'll call them.
19 stations
19.
spread across all 592 square miles of St. Charles County. As far as number of paramedics serving our community goes, we've got about 250 that work rotating shifts, with kind of divided up into two groupings. We've got our emergency platoons, and those folks work 48-hour shifts. Then we also have what's called our surge division, and they work 24-hour shifts. And that kind of leads very nicely into the next topic, and that is that, of that 56,309 calls for service that we respond to each year, there is tremendous variety. Whenever I ask everybody, what are reasons that people call 911 for an ambulance, I get generally the same guesses from everybody. Chest pain, shortness of breath, car wreck, that's everybody's number one. Everybody thinks car wreck. They think strokes, they think of cardiac arrest, they think those big medical emergencies. And most certainly, we do respond to our fair share of those kinds of emergencies. But we also respond to a lot of other types of emergencies that people don't often think about. It's the absolutely crushing abdominal pain that comes on with no known origin. It's the person who's undergoing chemo treatment and they're trying a new variation of chemo, and it reacts terribly with their system, and the next day they're just horribly ill and need to go back to the hospital. It is the kiddo that falls off of the jungle gym at school and has an obvious arm deformity whenever he sits up. It is the lady who's in the 8th month of pregnancy and wakes up at 3 o'clock in the morning and says, "This baby's coming right now." We see all of that every single day. We also respond to, as we talked about our surge division, that's a group that handles a little bit different kind of call. What we've kind of spoke about so far are the emergency situations. We also handle what's called non-emergency transfers. And that would be maybe if somebody is getting out of the hospital following a pretty serious inpatient stay, and they need to go to Del Mar Gardens, or need to go to Mount Carmel for some rehab afterwards. that trip from the hospital to the rehab center, they need to be medically monitored, so we handle those kinds of trips. Sometimes those non-emergency trips are from hospital to hospital. We've got great community-based hospitals here in St. Charles County with Progress West and St. Joe's and St. Charles and St. Joe's Lake St. Louis and Barn St. Peter's. But do our facilities have the level of capability that a SLU or a Big Barns do? No, absolutely not. Those are education centers that take up full city blocks. And sometimes folks exceed the capabilities that our community-based hospitals can offer. They need specialty procedures, specialty testing, a more advanced level of care. And we can handle those non-emergency transfers down to those larger hospitals as well. We actually have a dedicated team that's called our critical care transfer unit, and they can take the sickest of the sick. These are folks that have an advanced credential, but it's called either critical care paramedic or flight paramedic. And a lot of those trips that used to come out of our community-based hospitals that were in days of old sent via helicopter because these patients needed to get down to those bigger centers very, very quickly and with very, very highly trained staff. We've got folks that are credentialed to take those trips down, and obviously a ground ambulance much lower cost than a helicopter transport. So we got offering that as well.
So the airbag section, is that something totally different from you guys? Just curious.
Yeah, absolutely. What Stephanie's referring to are air EMS services. Arch is one you've probably heard of. Airvac is another one. And the number of times that we fly people off of an emergency scene here in St. Charles County annually is minuscule. Out of those 56,000 calls a year that we responded to last year, fewer than 10 did we fly off of the actual scene. Now, full disclosure, there may have been somebody who was a very critical patient that the hospital then later decided to fly down to another facility, but still not a tremendous number of those even. For the most part, what you see with the air EMS providers is those trips from the scene to the hospital happen in much more rural types of communities. We're very fortunate here in St. Charles County to have a great highway network and a great EMS network with a high number of trucks on duty every single day. Our minimum staffing in terms of number of trucks every single day is 24 ambulances. There's a lot of trucks running here in St. Charles County on the daily. So we are typically able to get even the most critical of patients off scene and to definitive care at the hospital inside 20 minutes. And that's generally our marker for whether or not we're going to request air EMS, as if we can get them to that definitive care in 20 minutes.
So you guys do that? That is part of
occasionally, yes.
We'll call them to assist. They
Gotcha.
basically are mutual aid, or they assist us. The majority of times when we use it, because I used to work out at our New Melly base, and a lot of times we have some pretty serious accidents where the people are entrapped. And so they're already critical. We're treating them while they're in the vehicle, but there's an extended time with that. So we will meet the helicopter because that will get them to treatment earlier.
Yeah.
But with now that we have our critical care team, that has reduced a lot because we can do the majority of the same things.
So as far as seniors go, I would think, just based on my experience, a lot of the calls, I mean, there's, but a lot of them are false.
Oh, you have teed it up so nicely for us. You took the, yes, absolutely. And that was the absolute next statement I was going to make, is that a lot of people are surprised to hear that our number one category of call is falls. 21% of our overall call volume is fall related in some way, shape, or form. Some of those calls are very benign, very minor, just kind of one of those, what people say, I just kind of crumpled to the ground. It wasn't the boom, hit it like a ton of bricks. But some of those calls are very serious. And it is the ones where it's like, you hit and you know that there's an obvious problem, a hip fracture, a femur fracture, something of that nature. And I brought along my resident expert on falls. And Sherry is one of two of our leads on what's called our Mobile Integrated Health Division. And this is something that we've We started dabbling in about a decade ago and has really just expanded and expounded exponentially over the last decade, thanks to Kimberlyn and Sherry's leadership in this regard, that now we're working with lots of people in their home to try and keep safeguards and safety measures in place to prevent activation of 911. Working with folks who have had to activate 911 a couple of times within a fairly short amount of time, so that you can start preventing that from happening and maybe get them set up with some resources in the home so that they are at a lessened risk. So with that, I think that's a perfect time to kick it over to you, and I'll let you kind of talk a little bit more about that, and we'll come back and talk about it.
We'll go back and forth.
Yeah, absolutely. You've heard enough from
Sorry,
me.
I'm screwing you guys probably have a whole
You're
flow and I'm
fine.
drinking.
Don't worry, we'll-
I'm drinking you up here, but.
We're
We
easy
roll with
going,
it,
don't
don't
worry.
Okay, all right, okay. Yeah, so, yes, I was not familiar with this. Is anybody else? I know 10 of us. She actually told me about that, yeah.
So what, we say we're a mobile integrated health team. What mobile integrated health, we are actually a group of community paramedics. Like Kyle talked about, we have critical care medics that have that advanced licensure in critical care medicine. We are on the opposite spectrum. We have an extra licensure, that's hard to say, and certification in community paramedicine. So our 911 system is reactive, right? An emergency happens, a situation occurs, you call 911. For community paramedicine, we are proactive. We want to prevent those calls that can be prevented. So we do a lot of education, prevention talks. We also are big on patient advocacy because, let's admit, we go to the doctors, they're very limited on their time, sometimes depending on the doctor, and you get a lot of information in a short amount of time, or if you were in the hospital, you get discharged and you got this big packet of information, and then they just send you home. And you get, it's very confusing. Changes in medications can be difficult. So that's what our team is for. We come and we help navigate that. We do medication reconciliation where we sit down and we literally go off your med list from the doctor and your bottles in your boxes, in your bags, in your cabinets, however you keep them. And we go off of that to make sure that everything is right. We also look for duplications of medications because when it comes to those falls, 21% of our calls, a lot of those are brought about due to medication problems. And it's not that you're not taking them, you're taking your medications. Sometimes the doctors change and you don't realize it. Sometimes you lose weight or you gain weight and it alters that medication, so there's a change. Or you're sick, or you have diabetes and your blood sugar can fluctuate. So those are things that we can come and help that may prevent those falls. And that is what our team does. We come in the home, it's about a 1-hour assessment. And we're pretty nitty gritty. We come in and we'll go through cabinets, kitchen cabinets if you're a diabetic and are looking for dietary education. But we come in and we do a full body screening. We do an assessment of all your vital signs, but then we sit down and talk to you about your health history. What is going on? And we know ahead of time how many times you've called 911 if you're a frequent caller of that system, and we can say, you're calling 911 a lot. You're having to go to the hospital a lot. Let's sit down and figure out what's going on. Is it a phone call? Do we need to have a conversation with the doctor and make them aware of something that they're missing? Or is there something in your home? Is it a rug that you have and you are walking with a walker and it keeps catching? Is it a rail that needs to be added to your toilet seat? Because when you go to stand up, those knees get weak, right? And as we get older, our bodies get weak. Do you just need something for extra support? So that's where we will go in and evaluate. And then we find gaps. And we look and see where maybe there's some holes that are causing you to have more difficulty, because our goal is to keep you in your home. We want to keep you where you want to be, as long as you're safe. As long as you can safely stay there, we want you to remain there. So contrary to what anybody says, nobody can force you out of your home, okay? So that is not our goal. Senior services are not going to kick you out. What we are going to do is try to support you and help you figure out what changes can be made to make you more safe.
So Sherry, can you tell us, it says, we have a slide up here about this, so with the phone number, and it says, see if you qualify. So what is it that you have to qualify?
Well,
for
our
something?
situation is with our MIH team, is we want to know if you have those gaps. Because that's what we want to catch. We're gap fillers. We have tremendous resources in this county, and we want to connect you to those services, right? So if you are somebody who is living alone, not having any medical problems, but all of a sudden you had a trip, like you fell on your way to church or on the way to the library, and now you have an injury, now it's causing some weakness, it's causing some problems, call us. If you have any questions, call us, and we'll determine if this is something that we need to get to your house right away and start talking to you about, or if this is something that we can maybe make an appointment for next week and come and sit down with you, give you some suggestions, and you don't see us again.
So you do house visits, you go to.
We go to the
Okay.
houses, we come to your home, and we are bringing our services to you. We do not bring an ambulance, we do not have lights and sirens blaring, we do have them on our vehicles. But we are a single clinician that comes in and meets with you. And like I said, our initial consult is about an hour. It can be an hour and a half, but we don't like to go too long because we all, our mental capacity just gets a little tired after about an hour. And we will sit with you and we will talk and find out, what are your concerns? What are your family's concerns? Sometimes we'll recommend, if you've got adult children that are part of your care team, let's have them at the meeting also, because we want to get everybody that's going to be in that decision process on the same page. That's what we do. And I will let you know, that is of no charge. We do not charge our county residents for that, because that's a service that the ambulance district provides for you. And then what we will do is, we will refer you, if you are weak and you need physical therapy, we will refer you to a physical therapy company. We'll talk with your primary care provider and see who they work with. If you need transportation assistance, we'll work with your insurance company, or we have resources to providers. If you are looking to go to a facility, you realize that you just cannot live on your own, we have companies that we can refer to that will assist you in making those decisions. So we're not actually the ones that can fix everything, but we can guide you to where you can get those problems fixed.
What we often find is that, sometimes folks just don't know who to ask for help in these situations. There's so many, we're bombarded with ads as we scroll through Facebook. We're bombarded with ads on every streaming service, on cable, from all over the place. And it's hard to know which is a good company to go to, which is not any not so great company to go to, who's operating in my area, who's going to work well with my insurance, and that's where Sherry and her team come into play.
So is anybody, I know Tina, you're the one that brought my attention, I was
Yeah.
aware of this service, so
Yes,
thank
we
you
work
for
with
that.
Tina a lot. Tina's one of our favorites.
And has anybody been aware of this or used these services?
We started in 2016, but I'll kind of explain why this is not advertised. Number one, when we started this, it was 3 people. Kyle told you how big our county is, right? And how many seniors and, community people are out there struggling with this. So initially, we can't put it out to the masses because we don't have the resources. So we don't want to promise something and not be able to fulfill, correct? So what we do is our 911 crews are our biggest referral source. They will run a call and we've trained them, talked to them, educated them on what to look for. And they will say, hey, we ran this person, they need help, and they'll refer. Our dispatch, our county dispatch, they've referred patients where they've said, we keep getting this call from this same person. Have you guys checked on him? And we'll go out. Senior Services, the Division of Health and Senior Services, we partner with them every day. Every day we work on patients with them, and they refer patients to us, we refer to them, and we're a great team. So we don't advertise out there on the news or on our billboards simply because we can't handle 10,000 people calling us at one time. But what we can do is when we do these talks, if you need us, call us and we'll set up an appointment, because when it comes to community care medicine, it's not an emergency, right? We're not emergency. If it's an emergency, we're gonna call our 911 partners. But what we do is more like outpatient. We do a lot with all of your outpatient facilities. We work with pharmacies. We work with doctor's offices, all specialties. We work with physical therapy, occupational therapy, public health. So those are the kinds of groups that we work with because it's not acute, it's a chronic problem. We do a lot of chronic disease management. We go through, a lot of our patients have CHF, which is congestive heart failure. They have COPD, which is a lung disease, or diabetes. Sometimes they have all 3 together. And managing all 3 of those can be very overwhelming for anyone. And so we can kind of go in and really help to facilitate that healthcare. So,
Well, thank you for sharing. That's really, really valuable information. I
Yes.
didn't know it was free. I thought it maybe was like an income qualify
no.
thing, so
No.
that's amazing.
We don't,
And-
yeah, we don't go by, the reason why we don't go by income for this, and I'll explain this real quick, I know we're on a short amount of time. We have a large population of elderly patients who.
Which none of you are.
No. But you're stuck in that gap. You don't make enough money to pay for 24-hour services or these $6,000 or $7,000 assisted living facilities, but you have pensions or you have retirement funds and your Social Security, so you're not Medicaid eligible, and you're in this middle group, but you still need help, and you're still on a fixed income. And so that's why we don't base it on income, we base it on need. If you need us, we're gonna be there.
So it sounds like this was a tool developed to, I know it's not just for seniors,
Oh, no.
but I think it's a lot of due to the increase, our aging population.
Yes.
And because of there being more emergency calls.
There's a wide variety of things that our mobile integrated health team helps deal with. Another whole separate side of their operation is helping folks battling substance use disorder. We've got a tremendous grant that has helped really increase the staffing of the mobile integrated health team because it's focused around opioid-related substance use disorder and routing folks into treatment and providing medication-assisted treatment to that patient population. Another arm of MIH is our STARS kiddos, and that stands for Special Needs Tracking, Awareness, and Response System. There's a whole group that works with families who have very complex special needs pediatric patients, kids that 20 years ago may have lived their entire life in a medical facility of some sort, but now, thanks to advances in medical equipment and just general overall care, can be at home with their families, but they still got a very robust care plan. And the MIH team, there's this kind of subgroup that works with those families.
We're a big umbrella with a lot of different branches, and where Kyle mentioned that falls are 21% of our call volume, mental health disorders or behavioral health problems are 19% of our call volume. So that is one of our big groups too, especially with the way the world is right now. We're seeing a big uptick in that. Plus our patients that have chronic diseases that can cause some depression and anxiety. So we touch everything, every age. We have helped patients that are 6 or 7 years old up to 103. So we reach any gap, anybody that has a gap or needs a resource or needs help, but they're not injured or need to go to an emergency room. That's who our focus is on.
So I was on your website, you guys have some really good resources on there, places that I've never heard of, so.
I will let you know, we are so blessed in this county with the amount of resources we have. The problem is we don't even know all of them, so how are you expected to know all of them? One of the greatest websites that we use for St. Charles County is the Community Council website. So if you just Google Community Council, they have a plethora of resources when it comes to the senior centers, when it comes to utility assistance, food assistance, anything that you can think of from one end of the spectrum to another, that is a really good resource to use. Also, your city pages, if you live in St. Peters or O'Fallon or Wentzville, go to your city page. They all have senior groups on there, and they do a lot of activities, they have a lot of assistance that a lot of our communities don't know about, so.
Thank you. You're clearly very passionate about it. It's a wonderful program. Thank you for coming
And you
today and
can breathe.
speaking about
Thank
it,
you.
So, a couple of things that we want to make sure we touch on, because I know, again, time's limited here.
So could we talk about the rapid
Yeah,
access first?
absolutely.
Love this.
So rapid access was a solution to a problem that we were starting to have with increasing frequency. And that was one of that 21% would suffer a fall. They needed help up, but they didn't necessarily need to go to the hospital, but they still needed that helping hand. And they were able to make the 911 call to get us to their house, but what they weren't able to do was get to the front door to unlock it for us. And did you know that on every ambulance in St. Charles County, and not really just St. Charles County, I think really kind of it's a fairly national standard. Did you guys know that we have a universal key that we carry on all of our ambulances that gets us into any residence or business that we need to get into? Did you guys know that? It's a sledgehammer. The universal key works absolutely everywhere if we have to use it. We don't like using it though, and you don't like us using it. We understand.
It involves a lot of people besides ourselves. Police are usually involved in that.
Yes, yeah, we don't like using our universal key for a couple of reasons.
But it
Because
works.
obviously, if we get there and the front door's locked and you're not able to get to it, we're not gonna go straight from A to Z and bust your door off the hinges immediately. We're gonna run around the back door and try that. We're gonna try a window and see if we can get in that way. We're gonna whenever we show up in a neighborhood, we tend to draw a little bit of a crowd. So we're gonna ask a neighbor, hey, does anybody do a key swap or anything like that? But if all those methods fail us, we do have to force entry somehow. We try and do it as minimally invasively as we possibly can, but at the end of the day, it is still forced entry. And it's problematic for a couple of reasons. Number one, as we're chasing all this down, it's a delay in patient care while we're trying to, and that's the most important one. You all may not say that's the most important one. In our eyes, that's the most important thing. Our patients often tell us they're more worried about the cost of the front door than they are the delay. But that's number two, is that it is damage that is costly for the homeowner to ultimately have to repair. And the third one that people don't often think about is that if we do have to transport you to the hospital, well, then your house is sitting there unsecured for who knows how many days while you're getting the care that you need. So all of this to say, we came up with this very low-tech but very effective system that could really help us if you ever need us and you aren't able to get to the front door. Those little lock boxes we have had for the last 15 or so years. And we purchased them from Home Depot at a little bit of a discounted price off of what their normal retail is. We have them at our office. And if you decide you would want us to have a means to get in, we will bring one of those out to your house and we will install it on your door jamb. Typically in between the front door and the storm door, but we can also go outside the storm door if you are somebody that keeps your storm door locked all the time. At the time that you purchase one of these little boxes, we will collect your name, your address, your phone number, and then you pick a 4-digit code. It can be any 4 digits that you want. It can be a combination of kids' birthdays. It can be a year you graduated from high school, which I'm assuming for you all was somewhere around 1987 or so, is what I'm guessing. And all of that to say, we will put that into the countywide dispatch system if and only if you call 911 and say, I've had a problem, I'm at 123 Magnolia Drive. The dispatcher is going to put 123 Magnolia Drive in. It's going to pop up and say resident participates in rapid access. Code is 1234, and we're going to come. And if the door's locked and nobody's there to let us in, they're going to enter 1234 on your box, and inside there is a copy of your house key. Quick, easy, safe. These little guys are stainless steel housing, stainless steel plate. The buttons are plastic, but all the rest of it is stainless steel. We have tried. We cannot beat on them and get into them, so we don't have that concern point about people being able to get into them and whatnot. The codes are kept incredibly secure. It is in a locked down system. At dispatch, we do not keep any paper record of it. Once we confirm entry into the system, that's it. Yes, ma'am?
I have a keyless entry, so would I just write my code?
Like your deadbolt is keyless entry
Right.
deadbolt. Yeah, I've got that too, and I entered it in the dispatch system, and we can help facilitate that for you. We can get it all entered for you if you've got one of those. Now, common question that I get with this is, well, I've got a garage door keypad. Can I just give you that number and then I don't have to have the box? Yes, we are happy to take a garage door code. That's totally fine. 2 things to keep in mind. If for some reason the power were to go out, that's not going to work. The other thing is then that requires that we leave the door going from the garage into the house unlocked all the time for us also, because then we just get to another door that's locked if we've got that all locked.
You guys have the similar problems that we as realtors have.
Yeah, and honestly,
Situations.
your industry is what spurred this
Idea,
program.
right.
Because back in the olden days, when it was the ones that went over the doorknob with
Yeah.
with the little hook, that's really what we took as
Yeah.
our impetus behind this program. And it, like I said, we've had it for about 15 years now, and it's worked tremendously well.
So I have a couple questions,
Yeah.
just to clarify. Okay, so first of all, do they need to purchase the box through SCAD, or can they just go to Home Depot and get one, or Amazon?
I would recommend getting it from SCAD, because we get a little bit of a discount from what you're going to get.
What do they cost? You know?
$30.
Okay.
Yep. So we get a little bit of a discount off of the sticker price at Home Depot, so you'll save a couple of bucks, not much, but a little bit. Installation, we will deliver the box to you, and we will install it on your door jamb for you if it is one of ours. We do not get into installing other boxes, just because we're not familiar.
Sure.
We know what we're doing.
So what's the cost for that?
Installation, nothing.
Free.
Yeah, so it's
Included with your
$30
purchase.
from start to finish. And another great thing about this that Kyle was talking about is you put a key in there. So when we transport you, we can lock your door right back up and lock that key back up into that system. So your home is completely secure. We're not handing keys off to anybody else. It's very safe, and then it stays in there in case another instance we need to use it.
And folks often want to know, like, can I give this code to my kids or to, yeah, absolutely. you can get into this thing anytime if you want to. It's not a problem. I've had people ask, like, is it gonna set off alarms or a bunch of ambulances gonna come?
It's very, very low tech. There's no.
Good question,
Yeah.
and no, it's not gonna set off anything.
So I know people ask all the time when we're, realtors selling properties that they'll see them and they're like, what is that for? And I think Catherine, who's here in our audience today, was there one on yours?
Yes.
Yeah. So she just purchased a new home, and the resident before them had one there.
Sure.
Okay, so, say we don't know the code.
Oh, that's okay, no problem.
So what do they do?
It is all still in the dispatch system, so if you just reach out to us, we will get you set up, and once we verify that it is now your home, as long as we get, it's probably easiest to just stop by our headquarters facility, make an appointment with either Amanda or I. We manage this program, and we can get that taken care of, where as long as once we confirm that you are the owner of that home, that villa, that condo, whatever the situation is, we can release that code to you. Or alternatively, you can call, make an appointment with Amanda. She'll look up the code in advance, and she'll come out and she'll change the code on the box to something that suits you. Because if the other person who had the unit before, it was a combination of their cat's birthdays, well, that's going to be harder for you to remember. So if you want to switch it to your cat's birthday, then we can come out and do that. There's no charge for us to come do that either.
Live in an apartment, how do they attach?
Can I ask where you live at?
Sure, Villages America on Veterans Memorial.
Oh, yeah. I know exactly, yeah. In between K and,
Yes.
and.
Bella Creek.
Yeah.
Yep.
Right on Bella
They go on the door jamb, out in between the front door and the storm door. If you don't have a storm door, that's totally
Creek.
okay.
They'll have a storm door, but we're not supposed to attach anything to the outer part of the building, that's why I'm asking.
What we always tell people who are in apartment complexes is run it by your management company, kind of show them what it is, and let them give approval on it. I've had people do all kinds of things. I've had people say, I don't care what they say, I'm doing it, and I'll just pay the $50 out of the deposit whenever I move out. Okay, if that's what you tell me, I'll install it. Or some people decide to go the approval route. Generally, what we found is most apartment complexes are pretty agreeable to the idea. It is going to save them a front door.
They don't want their front door, yes.
100%. I will tell you,
That's a
because
lot.
I've had to talk to building managers before for our patients that live in apartment complexes, and they were begging us to do it because we had one patient who was a frequent
Repeat,
caller.
yeah, frequent flyer.
And we beat the door down to where they literally had to fix the entire door jamb. So when we came to them with this, they're like, oh, please, our maintenance crew will meet you there. They'll install it. Don't worry about that.
So it's screwed in.
Yeah,
Yeah, it's
the
just a
housing, so this is a little faceplate, and this around the edge, that is a housing that attaches with 4 screws sunk into the door jamb. The little faceplate comes off fully, and there's a little ring on the back of the plate that the key attaches to. That's how it works.
So who do we contact for this?
I've got handouts right up here on Rapid Access, and on the back of it, there's a phone number. Amanda is our community relations coordinator. Just ask for Amanda whenever you call. She will be more than happy to come out and get you all set up. That's
Yeah,
no problem.
now, one thing I wanted to mention, because I had a conversation with somebody recently about this, who said they were gonna purchase one, and they wanted to put it in a different spot.
Oh, yes. This is a common one. People say,
Time is of the essence.
hey,
There's-
can I put this? I literally had somebody one time, can I put it on the side entry to my garage door, but the key that I put in there, I want to be my back door? But no, we're not doing all that. It really does need to go on the front door, because again, if it's a 911 situation, we need to be getting in quickly. And we can't list all this out in the dispatch system and turn it into a treasure hunt for our team and say, like, oh, run to this door and then this
The
goes.
only time where it's a little bit different is for certain apartment complexes where you have a back door, and that's the easiest, like your back door actually actually faces the parking lot where the ambulance comes up. And if that is the case, because we have some patients in Lake St. Louis like that,
Yeah.
but that's in the know. So our paramedics know the lock box is at the back door.
Right.
Very few and far between.
Very few and far
situations.
between, but don't let things deter you from using this program. We'll educate you and we'll get it in the best spot for your safety.
And the $30, that's a one-time. You're just covering our cost on the box. That's really all you're doing.
And just leave it in place at any point in time you sell or you vacate?
What I would recommend is just providing the code to your realtor if you ever go to sell. You can move it with you if you're moving from like a home to a villa kind of situation. You can do that, or you can just get another one whenever.
Okay, so as a realtor, I'm gonna say, leave it there.
Yeah.
It's attached,
It's just-
okay?
Yeah.
Stephanie, it should,
Leave it in place for the next person that maybe they have a use for it, so
Yes, and-
pass it
but
forward.
Provide the code to your realtor.
Yeah.
And
So like in this case, I don't recall that we have that code or not, so we talked about the box and I said, this is what it is, you know, probably contact SCAD
Yeah,
and they can
yeah,
get it all
absolutely.
set up for
We'll
you,
get it
so.
taken care of. And honestly, I would just say, call, get an appointment, say, hey, can you come out? I'm the new owner, I'll provide proof of ownership, and can we change the code? Absolutely,
Yeah.
no problem at all.
Cool, all right.
Fit more than one key.
You can, yes.
Because I got a storm door that I can lock, and the front door, or there's a key on the storm door. Okay.
Yeah,
I
totally
would
fine.
recommend you color code them, just so we know, because we don't, that's just time. So just make sure that, you know, like one says, or you can write with a Sharpie on there, just to help us, because at 2 o'clock in the morning it's dark.
Getting more than two in there is difficult, though.
Yeah,
I will
it's
say.
very
You
small.
basically
You shouldn't,
scroll
I
door.
can't imagine you.
Yeah,
Shouldn't-
hopefully you don't have that many locks.
Yeah, I was gonna say, we can't fit, I mean, it's just not that big of a box, so.
Yeah, yeah. And that's one thing I wanted to mention, because we run into that problem all the time as well. People lock the storm doors.
Right.
And they don't, it's such a habit. And then if you don't have a key for that,
And
you know,
it's
you got a key for the door behind that.
If you are
So-
somebody that keeps the storm door locked all the time, you can mount the box outside, like on a porch support post or something like that. My recommendation is just leave the storm door unlocked and tuck this on the door jamb in between the front door and the storm door. It just sits in there nice and easy, nice and snug, nobody even knows it's there.
Right.
But if you feel more secure with the storm door lock, we will work it out. Don't sweat it, no problem.
I was gonna say, I have one, and it's on the jam between the storm and the front door. You can't see it, it's on the back of the door.
Yeah. Yeah, you don't even know it's there.
No.
Yeah. Good.
Just, I have one as well, and
So you're saying I've been doing a pretty good job of marketing out here?
so my only thought is that you need to tell the people that you have to put the code back in order to
Yes,
Put it
to
back
put
to
the,
relock it,
yes.
relock.
Yeah.
We deal with about one a month troubleshooting phone calls where somebody calls up to the office like, hey, I got in here to do this and now I can't.
Or you're a paramedic that they didn't give you that in-service and you're at that house and it's 2 o'clock in the morning and you're trying to figure out how to get it back on. Yeah, you learn real quick.
Yeah.
So, yeah.
All right.
Let's also talk one other safety program that we offer. There we go. So, if rapid access is peanut butter, file of life is jelly. They go very, very well together, and I recommend all of you grab one of these on your way out. In fact, I think I've got enough for you to grab a couple of them. Take one for a friend also. File of Life is low tech, it is simple, it will take you 5 minutes to do it, but it is super helpful if any of our team needs to come help you with anything. Inside each of these little packets that we've got up here is a little paper insert. On the left, we ask you about the very basic, name, date of birth, height, weight, those kinds of things. We're not gonna share your weight with anybody who doesn't need to know it, I promise. But we do need to know it for medication.
Try to put an accurate weight,
Yeah,
not your
that's
driver's
right.
license.
Yeah, not your driver's license.
Just saying,
There's spots on
no
here.
judgment.
There is spots on here to let us know about emergency contacts. But you want us to call? Is there a son, a daughter, a spouse, somebody that we should get a hold of in the event that we need to transport you for some reason? Over on the right-hand side, there's spots to let us know about common medical conditions, and there's a few non-common ones also. Check the box if it applies to you. Everything from CHF, COPD, to high or low blood pressure, to a cancer diagnosis, if you care for somebody with memory loss, all of those things you can let us know about. On the back, there's spots to let us know about medication allergies. Funny story, we used to just say allergies on here, and we had people writing things like cat fur and peanuts. Well, we're not going to bring a Siamese in the back of the ambulance with us, so we don't even know about that. But we do need to know if there's certain medications that do not interact well with your system. We don't want to make the problem worse and give you those, so please let us know. There is a spot here that says medications, and it asks you to list them all out. Pro tip, don't sit and write all those out. Next time you're at your doc's office, on that little iPad that they're tapping around on the whole time you're there, there's a button on there that says print med list, and if you ask real nice, they will print one for you.
Real quick with that, anytime you go to the doctor, get them to print that med list, because that is your most recent, most accurate, and that way we always have it, and you always have it. Because remember I told you about how we like to look at that along with your pill bottles? Get into the practice of doing that and keeping it with this file of life. If something changes, take the old one out, shred it, and put the new one in.
Yeah. A couple other things to call your attention to on File of Life here. You see in the middle panel here, it asks you about important paperwork. In our world, important paperwork is an advance directive, a living will, and most importantly, a do not resuscitate order. I know this is not a pleasant conversation, and not something that people like to think about, but if everybody's got their own wishes when it comes to end-of-life care or ongoing, continuing care after a catastrophic medical event, if your wish is that you do not want us to attempt resuscitation if we find you without a pulse, not breathing, and unresponsive, all three of those have to be in the mix for a do not resuscitate to come into play. Keep in mind, if it's just a fall and it's a hip fracture, or it's a shortness of breath, or something like that, it doesn't come into play at all. A DNR only comes into play if clinically you are already dead. You just don't want us to try and get you back at that point. If you have that do not resuscitate, or any other kind of advance directive that you would like us to bring to the hospital with us, there's a spot to say, yes, I've got that, and here's where it's at in my home. What I always tell people is put it, what we sometimes get is gray filing cabinet in the spare bedroom.
Daughter's house in Iowa.
Yeah,
That's
a great spot for it. Yeah, exactly.
Yeah.
So we go in the spare bedroom in the gray filing cabinet. Looks like it's about ready to pop because it's so full. We have no clue where to begin looking for this. And of course, it's 3 o'clock in the morning and whatnot. So if you have those very important documents, what I always tell everybody, get a pocket folder from Walmart or Target and put it on top of your refrigerator or in your nightstand drawer. And just tell us on here, red folder on top fridge or green folder nightstand drawer. And that way we can grab and go.
If it's on file at the hospital?
We do not have access
We
to
don't
that.
have.
Just so you know, as
That's crazy.
paramedics, if the do not resuscitate order or your power of attorney paperwork or those things are not with us, that we can view it, we can't honor just somebody saying, oh, she has a do not resuscitate. We don't get into that. We need to see the paperwork. So that's why everybody giggled, but we've had that before. My daughter is in charge of that. She has the paperwork. Well, where is she? She's in Iowa. Well, that does us no good. So you need to, that daughter in Iowa needs a copy, yes, but you need to have a copy on your person for the medics.
And what I always,
A copy?
a copy
A
is fine.
copy
Yes.
is fine, yes.
Yes. And what I always recommend is if you have that, the advanced directive, which gets into like long-term artificial ventilation, artificial feeding, it's like 8 pages thick. You can throw that in a folder, that's fine. Or if that's on file at the hospital, that's
Yes.
fine. But the page that addresses resuscitation, that's the key one for us.
Right. We need to
Take
know,
it,
do you want it to?
fold it up, pop
do
it
you want-
behind this in this little plastic holder that we give you. You see there's a magnet on the back? Then that just goes on the fridge for us. We do not need to be front and center in the middle of the refrigerator. We don't need to compete with grandkids' artwork or anything like that. You can pop us on the side. We don't mind. That's okay.
We'll find it.
Then we give you this little sticker. It's like a window cling. And that goes on your storm door or a little light window near your front door. And as our paramedics are walking in, they see the SCAD logo, they'll go grab this
They'll go right
off
to
the
your fridge.
We have investigated, I don't know how many USB bracelets and scan this QR code to do this. At the end of the day, we just keep coming back to this has to be simple for
Yeah.
everybody in our community. It has to be simple for our team. And that's why we haven't gone the electronic route with this.
Keep it simple.
We try.
KISS method.
It doesn't work if you don't fill it out though.
Oh,
so-
also true. Yeah.
All right, so we had, in a previous seminar, we talked about, we have a lot of couples or people that they're a caregiver for somebody else. So what happens when you're the caregiver and you're the one
Needs
that
help.
it needs help?
Yeah.
What happens with the person that you're the caregiver for when they really can't successfully stay on their own?
We're running into a lot of this, that we have patients that have dementia, Alzheimer's, maybe some Parkinson's, and the spouse is the caregiver, and then the spouse has a heart attack or falls and hurts their hip. So what we do as paramedics, we are concerned for our patient, we're taking care of our patient, but we're also concerned about that spouse, because once we take our patient, that other person, can they safely stay in that home alone? And if the answer to that is no, we immediately will look at, do you have a daughter? Do you have a son? Is there a family member that can come and be with them? If they do not, then we get on the phone and we have another ambulance dispatched to the house, and we transport the spouse along with the original patient to the hospital, and the hospital will monitor and watch them until somebody else can get a hold of in that time frame. We never leave somebody alone that cannot take care of themselves. That's a safety problem. However, we need to know that, because Joe may have dementia, but in the 5 minutes that we've talked to Joe, he may be very alert and he may be fine, and Betty is unresponsive. We don't know that Joe has a problem, and we may leave, and then we find out later once Betty's woken up, what about Joe?
Do they put that in the information in the
Yes.
file of life?
Yes,
Is that the
that
correct
is
way to
great.
do it?
Each patient should have a file of life. However many people are in the house, if they're on medications or have medical issues, there should be a file of life for each individual that we can grab. But also, there can be a note that is by the file of life, Joe can't be alone. Or we can put it in, we've put it on addresses, like you get your medical alert and we put it in dispatch. We do have notes that says, if you transport this person, sister has to go also, because this has become more frequent.
Well, thank
If
you.
think
And-
about it, it's really, it's a different spin on what if it was a single person and they had a young child.
Yes,
I mean,
for sure.
We aren't gonna leave a 4-year-old at home alone.
But a 4-year-old is obvious.
Yeah,
A
this is not.
60-year-old or a
Come on up, Tom.
50-year-old or somebody else is not. So that's why we need to make sure that you have information in the house, or the police department knows that, so we can make sure.
What, hang on one second. Thank you for that segue. I'm just going to introduce Carl while he comes up here. Carl has been attending for, I think, a couple years now. Come on up, have a seat, pick
I
a
don't mind
chair.
Carl.
I'm going to sit down now.
Kyle, doesn't it?
Yes.
That's right.
You gotta watch
Yeah,
out.
trust me.
Can I say something before I sit down? You are what the library used to do before I retired.
That's right.
We always said we had health information specialists all gone for air fryers. But The idea of government is that it should work together, you should open up to the private sector. I got 6 figures from PJC to do this, and I don't know what happened to that. They've had,
Well, we need to have a conversation.
Get
Maybe
their
you can help me.
money.
So just so you know, Carl is retired, but how long?
35 years.
35 years you were in charge of the libraries?
Yep, from
Okay.
76 to 2011.
Okay, all right. Well, it's a struggle just to get a chair with arms here sometimes, so. So Carl, if you guys don't mind, I have a video to show, and Carl's gonna talk to us about his experience and share this so that maybe this is something you can do. This is Carl's house, April 23rd.
We can't answer the door right now, but if you'd like to leave a message, you can do it now.
Exercising at the Renault Center.
Yeah, so we'll share the story in just a minute. Nobody's home. Is Carl on the floor, passed out, or? Where's Carl at?
I'll take one, this one, and grateful that in the middle of the drive, police received medical alert for a go panel. They responded to you about no contact.
So
They are now responding to this call.
how to get in, right?
And the team is run on Spirit Center. We're back over there to see if that's where exactly at. They're there, they're here.
All right, I'm gonna stop it there. So, yes, they didn't bust your door down. I don't know, something happened. They got some further information.
And it popped back in.
Yep, so they were able to get some information at the end there that they didn't. But Carl, they came out to your house as a result of your
Well,
pendant.
let me just, I have a pendant. Anybody want my pendant? Just pick up the service, you can have it.
You don't want it?
Or else I'll throw it out.
Well-
Well, maybe you do.
Okay,
Depends on
well-
who you are.
Okay,
Let me just back up a second. In technology, it was 2014, I was walking through a Walmart, I'd lost some stuff in Waukesha County, which is the duplicate of St. Charles County. Same population, same demographics. We were going up to Door County on vacation, spent the night in Milwaukee. I made a 911 butt call, and I apologized, and I said, can you tell me where I am? And they said, you're in front of sporting goods. They had me pinned down within 5 feet 12 years ago. So I thought, well, this is pretty good. During that time, they used to have, I've fallen and I can't get up, and that, I checked that out, it was Life Call, which is now out of business because you had to have a line, which I hadn't had for 5 years. And I didn't want them to come to my house. I wanted to track me no matter where I was. So I bought this thing. I bought it because I have a T-Mobile phone and this is a Verizon phone, and I thought no matter where I am, I won't be in a dead spot. I'll just push this button and it'll be great. Wrecked my phone the day before I washed it. Okay, went down to Best Buy and got another phone. And everything was being shaken down. I'm at the Recplex. They've got a volleyball game going on. I couldn't get on my normal equipment, so I got on this rolling thing, pressed it to my chest. And I heard talking, but there was screaming from volleyball, there was this, there was that. Going to Walmart after exercising, driving up Highway K, and this picked up on my car. You know, what is, you know, so I got on my phone and everybody's standing out in front.
you're looking at your ring.
But there's a huge delay on the ring, so I kept saying, I'm here, I'm here, I'm here. Finally, after they were leaving, it still was looping, I'm here, so they kept running back in. I said, no, I said that 10 minutes ago. So I wanted out of this. I don't trust this. I don't know what happened. They're very nice people on, this is Lively. This is made by the same people that bring you something I've never understood, and that is, what's this what's the dumb phones that they sell? Wait, lively,
The Jitterbug.
Best Buy.
The Jitterbug.
Jitterbug. My least favorite company of all time. So Best Buy owns it, even though I bought it through Amazon. Somebody wants it, they can have it, $20 a month. 30 if they crack it and they fall down.
So you set it off when you were exercising, you didn't necessarily realize it.
10 minutes later, everybody's out in front of my house.
So why did they go to your house?
They just tore off the screen.
No. Why did they go to your house and not
Well,
come
that's the
to you?
question I have. I got this because I wanted to be tracked where I was. I was 4.5 miles away and they had no idea where I was. Now, I've asked AI about it and they said, oh, that's their legal fallback. I don't want that. I could have been in a ditch someplace, you know. I could have been down in the Boothill in a ditch and pushed it down to send people to my house. And according to AI, that's their standard procedure.
Did you talk to the company?
I talked to the reps and I dropped the company. I dropped the whole thing. I asked AI what I should do and they said, this happened. They said, my AI thing said, this happens all the time. You want a smartwatch?
So-
And you're restricted to 2 smartwatches. You're restricted to, unless you get, I don't have an iPhone, so you're restricted to Google sells one for $380 and Samsung sells one. And I push this. You're supposed to. There's another problem I had, still have. You're supposed to push it 5 times. Anything 5 times. Your phone 5 times, and it's supposed to bring 911 up on any Android. I push it 5 times, nothing happens. I can call you because if I think to hit it with this finger rather than this finger, it'll go to like on the stranger, it'll say dial emergency. Or I have a big E here and I can hit that and I'll dial 911. Or sometimes I hit the phone, the watch 5 times and it works. And sometimes I just bring up emergencies, one of my 5 friends that I have on this, so if I hit that. So as long as I can hit my finger, I've done it. I don't want to go through a third party that has no idea where I am. I think it was operator error. I don't think she looked at her screen, and so I was pinging 5.5 miles away.
I'm surprised to hear you say it got that foul. I wouldn't be surprised if it was not one that was supposedly GPS tracked.
Correct.
But I'm wondering, is it connected to your cell phone?
Yes.
The day before, he washed his cell phone.
No. I pulled the whole account over. Everything was.
So, but that's where I'm saying, but that was just the day before, right?
Right. No.
But that's where I'm saying, I'm wondering if there was some confusion with maybe everything switched over.
I think everything switched. But I think, and as I say, I was in there, they were screaming at the volleyball thing. I heard them talking to me, but I didn't know what it was. I'm looking at my phone.
Yeah.
Some of the tones were different.
Yeah.
So
it sounds like it did work. It's
It
just
worked and I picked it up. So it was partially my fault. They called my daughter, who didn't answer, because nobody if you're gonna do this, make sure everybody puts in, because nobody answers strange numbers.
And that is absolutely an issue.
Right.
That, you know, there's only so many safeguards you can put in place. And that, you're absolutely right. That is a real one.
The downside I have, if I hit this 5 times, I have entered everything you need. All my meds, everything are on the phone and should go over. If I hit this, I'm getting 911. One of my friends is emergency, and I also can get it on my phone. I'll be able to talk to 911, but you won't get all the accompanying stuff.
Yeah.
I don't know. I'm doing AI told me 5 pushes. I was listening to a Kim Commando podcast this last weekend. They said, people with Android phones, you don't know how to do this, but make sure you enter all this stuff and push your power button 5 times. Doesn't work with me. I'm going to do it. 1, 2, 3, 4, 5. Now it'll work beautifully.
All right, so a couple things that we found out in doing some research based on finding out about what happened with Carl. And I'm sorry that happened, but I'm also grateful that you found out and you're taking actions that you think will be appropriate for you. First question is, did you have rapid access on your house?
No.
Okay. Okay. All right. So that's on your to-do list.
Yeah, that's gonna
Okay.
be.
But we did some research, I'm going to show it in a minute, and these slides will be available on our website too. So there's things that can go wrong on them. First of all, you have to be wearing it. There's a range that they can go. The batteries can fail. If you're unconscious and, can't communicate something and they're trying to talk to you, and you can't, another thing is they can't explain the medical history. The biggest thing I think we found out is that there's a lot of different things to check into when you're purchasing these things. And GPS is definitely one of them. So we looked at several different ones and they all have different, things.
I was gonna say, I repeatedly at people's houses, when I was over at your place, Holly, we actually asked, where am I? When we hit when we got the person who lied. They got it wrong every time, but they were in the area. They were, I think in your case, weren't they over a couple of units?
Yeah, the owner apartments.
That's still not.
I had a 93-year-old friend, I was trying to show him how it worked, and I pushed it, and I said, where am I? And she gave an address that he had no idea where it was.
Mm-hmm.
So I should have known at that point. But you think, if they could find they told me I was in sporting goods in 2014 in Waukesha, well, I can't likely tell within 4.5 miles.
And the 911 system here in St. Charles County, fantastic, absolutely fantastic. And like you said, it is paying down and it keeps getting more and more advanced.
With yourself.
I've lost mine. You do find your phone. I remember one fell out 6 years ago at Anytime Fitness or at Planet Fitness. And I was able to call them on another phone and say, when you pick up that phone for me, it's under I knew exactly where the building was. So the idea to get off by 4.5 miles is pretty
unacceptable. And
I could have been lying in a ditch in Kabul someplace, and they would have sent people to my house. And apparently that's their standard procedure.
Well, in that, I will just let you know, we get calls all the time to people's houses by medical alert, because if you don't answer, they will automatically send 911. And so we go because there could be a medical emergency. Now, we do not provide medical alert services. As community paramedics, we recommend them to a lot of our patients, especially those that live alone. And we tell them to call the service. We're most concerned, the majority of our people, when they're in their home and they're falling outside, they have a much better luck with their cell phones. But in case they go unconscious, they need to make sure that they have those GPSs. We recommend that you use a company that comes to your house and sets things up. Because a lot of times, it's just with a lot of things, we can buy everything. We can get anything. I can go buy a hospital bed on Amazon right now for $700. But I don't know how to use it, and I'm trying to figure out how to use it. So you want to use a company that actually has a rep in your area that can come and show you to make sure everything is working.
And do you know who that might be?
Well, that's where I'm going to be honest, I'm going to throw things out there.
Yeah.
When I go to people's house, I Google, what are the top 5 medical alert companies? And I can tell you that these are. I know these names very well. And the reason why I do the 5 is because every person's need is different. And everybody's price span is different. These are just like cell phone packages, so it is very individualized. So that's where I recommend you call and use and know exactly what you're looking for. Like, he knows what he wants, 100%. He just needs to find a company that can accurately provide that.
Right.
Now, the other thing I was gonna say, this was 23, if you fell down, they wanted another 10 and I read the reviews on it, and it said it had increased false alarms by 500%. So I said, they said, well, you might be, you might be, I said, well, if I'm unconscious, I don't give a damn. You know, it's like, I'm not paying $10 an hour to increase the
Well,
chances of
that's
this happening.
you, but
Yeah,
others
that's me.
might.
But this does cover if you fall.
Okay, so this has GPS tracking, and the first two say they do have GPS tracking, and the second two say they do not.
What does that mean? What
So-
would you be if it doesn't?
It's
GPS
just,
track?
so the ones without GPS are usually, there's a base that goes
That goes in your house.
in your bedroom or in your kitchen, typically is where most people put it, and you just get a radius.
Okay, but if I'm out.
Yeah, it does.
Yeah, that's
what I'm saying,
Then
it's
you have
not,
nothing.
right, it's
Right.
not
It's
for
like a
you.
wired system, which is when I said, well, who wants that? You're gonna
Right.
drop dead someplace
But a
else.
lot of people aren't as active as you
Yeah.
are.
Right.
So that's where everybody
Right.
pick your, that's where you get to pick what specialties you.
So it's just important to know, okay?
Hundreds.
Know, do the research, look at the, the different ones, and, see what works for your lifestyle.
Well, I think we all know
You had
people
something to
that
say?
take these off in the showers so they don't get wet. That always is amazing to me.
And you're Carl's daughter? Oh, you are? Oh, okay, sorry, Holly. One of you had their hand up, yes?
My grandmother has metal alert. Do those, necklaces need to be charged? I just started like taking care of versions 94, but I don't know, do those need to be charged? Can you check them?
I don't know, I would call the,
You would have to call the company to find out, because for the charging purposes, there's usually a charging port that it charges with if it needs to be charged.
That's it.
And so,
Hers is super old, it's like hooked up into her landline and everything.
yeah, so that may be different.
Could be
because
button
it's-
batteries on
Yeah.
something like that.
That could be one of those lithium batteries like a
I was
watch
gonna say,
battery.
Holly, you used to look after your grandmother, not my mother. But she used to say, what? Oh, I had to look all over because I knew you were coming over. I had to look for an hour to find this right, was it ever coming?
She told me, I know you like it when I wear this, I've always been on when you come over. I was, well, the whole point of it is I'm not here.
yeah.
She would have been one of ours that don't fill out the file.
She would have been one of my team. She would
Yeah.
have been one of my team.
Yes,
Push
thank
button
you.
works.
But this thing here, I can just tip my phone once, I can talk through my phone, my watch as well. So,
Yeah, so that's what you're gonna use.
I'm not using this again, that's for
Okay,
sure.
all right.
In June, last June, on Friday the 13th, I tripped over my own foot and just went straight down and broke my thigh bone and my hip.
Oh,
And I got one of the medical alert devices that I have on a belt clip right here.
Were you alone when that happened?
I was at my daughter's house and everybody was looking at me. I kept saying, you live by yourself, you need to get one. So I'm at her house, she's got a single story, I have a two-story.
And this tracks you no matter where you are.
The GPS sucks, that's not good, but I had gotten it and I set it, I put my phone number in it, and I had sat on the kitchen counter for like 2 weeks. So my friend was over, and I said, oh, I have this thing, and I just laid it down on the counter, and all of a sudden my phone goes off, and it sounds like sirens, and it says, are you having an emergency? And I said, what the hell? So I took my phone out, and I said, hello, she said, your device went off, are you okay? And I said, yeah, I said, I must have accidentally hit something, and I said, you're gonna cancel cops and, whatever, and she said, yes. 5 minutes later, St. Charles County cop knocked on my door just to make sure I was okay. Because it could have been a situation where somebody was there and made me say okay. And when I set I have the app on my phone, and all my kids can have it. And so we did a test, and she said, press the SOS button. It rang 2 times, and the gal answered the phone. She said, "Are you having an emergency?" I said, "No, it's a test." Then the gal on the phone that was helping me set it up, she said, "Go where there's carpet, drop it." I dropped it. Within 2 seconds, the voice came on. She said, "We sent the fall. Are you okay?" And I said, "Yeah, it's a test." You know? And so anyway, the other night I had it on my belt clip, and I took my jeans off and I laid them over the footboard of the bed, which is an iron bed. And all of a sudden I hear, "We detect the fall. Are you okay?" And I said, "I'm fine." I said, "You know, false alarm." And then back to the ambulance thing, when I fell and broke my hip and my thigh bone, my daughter called the ambulance. You guys were there in less than 5 minutes. Took me to Mercy.
We take good care of it.
They were just wonderful. In fact, they called ahead and had a bed waiting for me in the emergency room because other people were inside the actual unit were sitting in chairs. And I had a bed waiting for me.
Good deal.
Now I had to wait 5 hours before I even got a shot.
That's about the end of our ability.
So anyway, but my question is, I'll back up real quick. On my app, I have what my code is, special instructions, whatever. And I have on there, I have a large, what is it? He's not a pit bull, he's part pit bull, but he's a Staffordshire Terrier. So I put in there, I have a Staffordshire Terrier large, and I put in there dog cookies on the step.
Very helpful.
That was actually something that we did have on a slide that says that can prevent the.
Can I give you that link to, I can send it to you.
Okay.
On Dispatch's website, which, you know, clear as mud, right? St. Charles County Dispatch and Alarm is completely separate from St. Charles County Ambulance District. You would think we are both departments of the county government, but we are not. We are our own separate thing. Dispatch is a county government department. And on their website, there actually is a form that you could use to let dispatch know about everything from I care for somebody with Alzheimer's all the way to I've got a very large, you know, I got a St. Bernard that sounds like he's, you know, going to come through the door at you, but he's, you know, harmless kind of thing. Where you can let them know about those things and then they can provide that information to any first responder that's on the way to your house.
Yeah.
We can send you that link to
Okay,
get to it.
this was the slide I was referring to, and it has pets blocking responders is a safety gap, so.
Some pets are very territorial.
Yes.
Okay, well, Carl, thank you so much
Yeah, I was gonna
for
say
sharing.
One final thing, I gave this away, or I put it in my car for this presentation, canceled it. They said, "Yeah, you're all canceled." Charged my phone, went in there, apparently hit the button as I put it in my car. My phone was ringing. This is a week after I canceled it. They said, we're calling 911. I said, "I dropped you a week ago, just lay off. Are you sure we're gonna send somebody to your house?" I haven't heard the one we send whether you want, but I think they think the safest thing to do is to get them to your house. But if I wanted to get someplace, I don't want you.
Okay, all right. Well, you need to do some more research, but thank you for sharing that. And the other thing, in case you didn't hear, was when you set up those services, okay, and you need to tell your, you know, whoever your responsible party is also that they're gonna call, family, friend, whomever is your point of contact, have them program that number in their phone. Because they tried to call you, right?
But even that's, I mean,
They
I will,
have varying
they've got varying
numbers.
numbers. It's a call center with probably
Yeah.
dozens of phone lines,
You can
so.
do that, you should, if someone comes and sets it up, yeah, of course, test it out, however you
Yeah.
write, it's different numbers.
Yeah,
Yes.
you're absolutely right.
Yeah.
And I'm just the same way as you are. If I don't know, I answer that. Yeah, I don't want to do your political survey. I don't want to do.
If they left a message and said, "This is the 911 call system, an alarm went off at your dad's house," then you would have seen you had a message and it checked it and then could have
Who
called
looks at
back.
voicemail? I don't, for me. I don't.
All right, so Carl, thank you so much.
Yeah, I was gonna say.
And Dave, can we have you come up? We have another story we would like to share with you, another recent incident.
got a good one for you.
Okay, come on up here.
Question?
So this is Gabe, he's a realtor on my team, and he had a very real situation. Come up here in the middle.
Sure.
Okay, so tell us what happened, and we just wanted to share this because there's things that happened in this scenario that were like, they weren't prepared, so share with us.
Very much so not. So I'll lay a little bit of the groundwork. I, of course, like Stephanie said, I'm a realtor on her team, so I was out in some rural counties with some investor clients of mine, and I'll try to keep this as short as I can because I know we're on a time crunch here. But to just be transparent, I wasn't headed to just one house per se, let's say their primary home. I was in the vicinity of their primary home looking at other investment properties in the nearby vicinity. So while I wasn't at their primary home, I was very close to it. And I was doing my deal, going around looking at these investment properties one by one, and I got a call.
You had an appointment.
I did. I had an appointment set with these clients that morning at 11:30, I believe, because we were going to do lunch. And the wife always cooked lunch for us when we met. So that was what I was headed over in that direction for. And she called me while I was out doing my real estate stuff and said, just trying not to use actual names. So I'm going to call them Mike and Diane.
Okay.
So Diane called me and she said, Charles isn't breathing. What do I do? And me.
Is it Charles or Mike?
Mike. I'm so sorry. I tried to keep that straight, but no last name. So Diane calls me in a state of absolute panic. Mike is not breathing at this time. And I said, okay, well, you need to start CPR immediately. And she goes, I don't know what that is. And I said, okay, well, again, I am not at their primary home, but I'm very close to it. So I, at this time, am breaking the law, driving like I probably shouldn't be driving to get to their subdivision, because I know that I am going to be the next best thing in getting Mike some help, because she was not prepared in this situation, unfortunately. And that would probably be my biggest share in this story, is to be prepared for something like this. Now, Mike was about 86 years old, and Diane was about 65. So she was able enough to do CPR if she absolutely had to. However, she was just not necessarily prepared for it. And unfortunately, another thing I would say is to be more prepared for things is to learn the signs of things. For example, I was going to meet these clients for lunch. We were scheduled to meet around 11:30, and when I got there, of course, all of this had transpired, but Mike was not feeling well that morning. So he ate breakfast and then went back to bed. And I'm sure the paramedics might be able to say that there could have been signs, or maybe not signs, that she could have picked up on. However, she didn't know what signs to initially look for. So Mike had went back to bed and rested for about 3 hours and most likely passed peacefully into his sleep prior to me arriving and trying to resuscitate him and do all of that process.
So, question. Did she call 911?
Well, I left that part out. She did not call 911. She called me instead for realtor, which that is not advised.
I was going to say, my alarm started.
Yeah.
And real quick to let you know, when you call 911, they will instruct you. They have done this for 3- and 4-year-old children, and they will do it for adults. They will ask, are you able to do CPR? And they will talk you completely through the process of that.
Absolutely.
So always call them first, then call your realtor.
Always call them first, then call your realtor. I advise to call your realtor first,
I mean,
but
we'll help it if we can.
Yeah, I
Yeah,
mean, you would.
that's above and beyond the
That's
call of
good
duty, right?
Yes.
Yeah.
So you had to tell her, hang up, call 911.
that, well, she was in such a state of panic, I wasn't getting anything out of her,
Okay.
unfortunately. So even, like you said, 911 was like, well, who is at the house now? Who is there that can perform CPR? And unfortunately, the wife was in such a panic state that she was not going to be helpful for CPR. So that just goes into saying, one more time, being a little bit more prepared for it. This situation and outcome definitely could have had a different outcome. But in It didn't, unfortunately.
So, you did arrive at the house.
I did. I arrived at the house, and while I was actually the one that called 911 because I was not able to get anything out of the wife at that point. So of course 911 is trying to coach me through instructions on how to give CPR, and I'm doing 90 miles an hour for a residential subdivision, trying to make it to their house because at this time, while all of this is transpiring, I am getting closer to their primary home as I am traveling, while one, talking with the wife, hanging up with her, and then two, calling 911 myself. I was able to finally make it to the home where I started doing CPR on my client in the entryway of his home. So that's another thing that I thought was really nice that the paramedics, I'm sorry, Kyle, I remember your name, but I don't remember your name. Sherry. Kyle and Sherry made a very good point. In St. Charles County, we're very blessed to have ample resources as far as EMT goes. In the rural counties out in Missouri, that drastically declines. So it took probably about 30 minutes for EMS simply to even show up. Not to work on my client, not to do anything else, or to arrive at a hospital within that time frame. It took them about 30 minutes to show up. So that's another reason that you be even more prepared when you're somewhere in a rural area or somewhere where a hospital maybe isn't nearby. It definitely changes a little bit when you're not in St. Charles County.
It really does. And I will tell you, my husband used to work and he came across a similar situation. And he was in another place, and he called 911 on his cell phone, and this was before they had the geocaching and everything. And the 911 operator was in St. Louis City, and she had never even heard of where my husband was. So that can be very scary. And that's where I always advise people, when you go to retire, think of these things. Think of the communities, think of your medical problems, think of where you are going to be residing at an older age. You know, my husband and I were getting to that age, and my husband wants to be in a cabin in the woods, completely turned off from everything. And I'm like, yeah, that's all well and good, except because I worked out in New Melly, and I can tell you, running lights and sirens out there, it still takes us 20 minutes. You can only go so fast on a curvy road to get to somebody to do this medical care. So think about those things. And then secondly, you almost have to prepare yourself to, and it's difficult because whenever an emergency happens to a loved one, it doesn't matter how trained you are, even us, it can go out the window. But at the end of the day, everybody does the best that they can. And that poor wife, I'm sure she questions herself time after time, but there is a time at the end of the day where there is a higher power, there's someone where it's your day. And unfortunately, all of our efforts do not come to fruition or the result that we want. But I love the preparedness and making sure, but also it's just knowing where you live and what resources are available and how quickly they can get to you.
Gabe, thanks for sharing the story, and I think what a great job.
I did. So I was actually trained in CPR at church camp at a very young age. So I'm not gonna lie, I was probably really rusty in giving it. But with that being said, there was a off-duty firefighter that joined me about halfway through CPR. So he was able to actually, he heard the address come over the radio and was able to join me inside the home. We are both covered in sweat by the time that EMS got there. So it was just, it wasn't the greatest scene. It was definitely a workout. But like I said, it really funneled things in for me in wanting to be a little bit more prepared for not only just that type of situations, but other situations as well. So, and seeing how unprepared the wife was, of course, was kind of like, whoa, that's, and, you know, just like Sherry. Just like Sherry said, there's of course a higher power at the end of the day above us all, but you never know if that outcome could have been different. If the wife would have been a little bit more prepared in that, or would have seen some signs in the husband, or maybe he went back to bed that morning. I know there's a lot of what ifs there, but maybe there could have been some signs that she could have caught on to and said, maybe you're not feeling too well, or maybe you should do something different other than laying down.
Yeah.
And thanks for your valiant efforts on
Yeah.
that. We appreciate that. Thanks.
Yes.
He did not. Unfortunately, he did
Yeah,
not.
I know,
Yeah.
that's the bummer of the story, but,
That is the bummer.
you know, it's a real life situation, and it happened like less than 2 months ago, so. All right, that is real quick, you're gonna get a chance to ask your questions, okay? But I'm gonna say ran over, thank you for your patience. If you wanna sign up for next month's seminar, we are gonna be doing some of the setup for medical alert things. And kind of have a
My
workshop
chart,
on that.
everybody, please do that. I love that you're having that. That is a huge connector to your primary care physician. They will answer you quicker on my chart than you calling and leaving a message. So I will tell you that. I love that we're doing that.
Okay, good. Can you come back and help?
Mercy has their own.
There's two
Mercy
different.
Mercy has their
You
own.
can tie them together.
It's, yeah.
Yeah.
BJC and SSM are of my chart, and then Mercy's is their own, but they can all come together.
They can, yes. All right, well, let's give these guys a wonderful round of applause. For all that you guys do for our community and keeping us safe and educated. And questions?
Yeah. Everyone, right back there, all the way in the back. What you got?
Yeah, just to walk back to the file of life, we've had ours filled out for several years on the side of our refrigerator. And when we were given it, we were told maybe it'd be best to fill it out in pencil.
Yeah.
So you can change it as you went along. So that.
Yes, always. That more had to do with the back before the med lists were
Yeah.
quite so common
Yeah.
with electronic
Right.
record keeping at the doc's office.
Yeah.
That's why we recommended that. You're still welcome to do it that way, but it really had more to do with med dosages than anything else.
Yeah. The other thing is, my husband has Alzheimer's, and I have him registered with the St. Peter's Police.
Uh-huh.
Is there any interaction there, or is it just helpful for the police?
I would tell you, it depends on if you registered it on the county's website, because I would tell you that is a helpful thing to have, one of those special need forms on the county's website. And I'm gonna send that to Stephanie, so she has the link. So I think perhaps duplication might not be a bad idea there, but certainly have a file of life for him also.
At St. Peter's, when you call, St. Peter's dispatch is the ones that contact our dispatch. So you're okay until you can get all that double dip.
Yeah.
I just want to say, we had our first experience with calling an ambulance last September. Unknowing to me, my husband had COVID. He just collapsed on the floor. I called 911. They came out, fire truck, all of that, EMTs. And it's just a heartwarming thing to me. I told them his name was Jack as they're walking through our house and going to the bedroom. And as the EMT, one of the EMTs of the three of them, turned him over, he said, "Is this Jack Beckerly?" And I said, "Yes." And he said, "He was my advisor at Lindenwood, department chair of fire and paramedics." Kyle, I think you know.
Very well.
Yeah.
Yeah, thanks.
But it was heartwarming that they remembered him.
Yeah. Now, so you said the name and it clicked immediately.
Yeah. But they were wonderful.
Tama, you had a question?
Yeah, I had a comment.
Oh, comment.
My husband also has Alzheimer's, and he would fall. And so instead of calling 911, I called lift assist. And the firemen and the ambulance would always come out, and they were wonderful. They'd come and they'd pick him up for me. It wasn't an emergency, I could not move.
We understand.
And we
get
do
it.
that all the time, but just so you know, it's the same.
It all goes the same place.
It's the same, whether you call 911, lift assist is the same paramedics that run your chest pains. It is just a non-emergency number that they give you, but the crew that responds is the same crew that's gonna come if you're having difficulty breathing or whatever. This is a misconception. A lot of people think we have a lift assist program in our county, and we don't. It's the fact that if you need help, you call us and the paramedics come
So
and do
maybe
that.
that people are more likely to call or to get.
I don't know if dispatch gives that number out or what the.
What happens after a while, I think if you have dispatch will give that out. We do not give that out. We just say call. So that's a dispatch thing. But if anybody falls and you cannot pick them up, believe me, we don't want you getting hurt. We would much rather you call us. So you can call 911 and tell them it's not an emergency. He fell on the floor. He is safe. He's not injured. And they'll still call us. We won't come lights and sirens, but we're still going to come. They will probably ask their weight because there's only 2 bus medics. Sometimes if they're larger, we're going to have the fire department so we can all do it in a safe manner. But if they fall and there's a risk of injury, they're going to send the fire department and the ambulance. And a lot of times you'll get PD too. Don't be alarmed. It's just our response. We're a big team. We love working with each other. So that's great. I'm glad. That is a resource that we have because we don't want you getting hurt at all trying to lift him up. So.
Yeah, then we gotta send a second truck and it's a whole ordeal. So it's just
All right, well, thank you guys so much.
You're welcome. I'll send you that form for this one.
I appreciate it. And I have an extra file of life forms and I can
Yep, and we've got some files of life, rapid access info, fall prevention, and all that.